working on improving healthcare, but the real challenge is how do we improve the health of the population? And consumers have the tools now. They use the web, they use MySpace, they use Facebook, they have Blackberries, PDAs, iPhones, you name it. So let's not wait for the healthcare industry to improve their processes. That's a good approach. But there is a parallel approach. Let's look at what you have in your house right now, and let's bring you the tools that can help you take care of your own health. Thank you.
Thank you, Jose. Another impressive mind. As a matter of fact, between now and the time we break, it wouldn't surprise me if Pete and Jose figure out that Rubik's Cube there amongst themselves there. And as he was speaking, we had another special guest join us, Andrew Carecart. Thanks for coming, Andrew. Appreciate it. Our next speaker is Juan Rodriguez. Juan is the Vice President of Technical Services for Advanced Processing and Imaging, Inc. I'll call it API because I'm butchering that one for you. The company has been in business for over 12 years, providing efficient software solutions with the primary focus on helping clients control documents, records, and files. Located up in Deerfield Beach, API provides document imaging and record management solutions for a wide variety of customers, including government, financial, legal, education, and of course, healthcare. Prior to getting involved here, he was a founder of this company and others in the technical field, and for over 20 years, developed infrastructure, management services, and document software. He serves on the board of Microsoft's Regional Association of International Business Partners and is a member of AIIM, that's the Association of Imaging and Information Management. He brings over 12 years of experience in the document management industry, providing solutions for small business owners to larger multinational companies. With that said, Juan, it's all yours.
Thank you. Thank you very much. And I also would like to thank Jean and her group for this opportunity. Basically, what I want to bring today is information that has been repeated over and over, I guess, if you will, in many different ways, shapes, or form. The ultimate goal, as it was just said, is to have better health. And when we don't have better health, have better ways of analyzing data to get there, to provide the diagnostic tools to the providers that they need to make correct decisions. If you will, today we have a bunch of technologies, as it was said, more at home than sometimes in the doctor's offices themselves. Hospitals and practitioners alike are challenged with funding requirements necessary to achieve a lot of the technology benefits that are available. Well, one of the important things to note about information is how easy it is to get, use, and implement. And one of the challenges that most people are faced with, and think of it this way, for the practitioner, taking us back to the Stone Age, you walk up on a patient with no knowledge of medical history. You have to make a diagnosis dynamically and provide some kind of care. Right now in our world, we wouldn't do that. Doctors are concerned with malpractice suits, wrong diagnosis, but yet we live in an environment now that has the technology to be able to provide that doctor full diagnostic information on the street, through the PDAs. Patients can have access to their records. There are technologies out there that provide that. Well, our company has focused primarily in the document management space, enterprise content management, throwing a couple more words out there, and taking a little bit about what Pete just said. The tools are out there. It's not like you have to make something new, something different, in order to give you the tools necessary to provide collaboration, to provide the telehealth, if you will, to patients. It's no different than web conferencing. It's no different than document management for a city, Coca-Cola. It's the same tools, it's just applying them differently. And what we're doing in our company is providing those tools that we have been successful implementing throughout the country and internationally to help cities, higher ed, private industries control information, paper, and we're applying that to the healthcare industry. How are we applying it? We're making it accessible down to the practitioner level as well in the organizational level. Now, a lot of people, as we heard, practitioners are challenged financially to put technology in there. But how can you make that same solution that is worth $1 million on one end fit in a single practitioner's office? Well, it's very simple. As it was just mentioned, young companies rewrite the law, if you will, the game rules. We've made the software. We can give it away if we want to. There's no rule in law saying that it has to be this price. Yes, we want to keep the lights on. Yes, we have mouth to feed, and we are not doing this for a noble, if you will, reason, if you will, to help healthcare. But yet we can. In our company, we're doing that. Very simply, we have, as an example, I have an ophthalmologist down here, not too far from here, who's using our system to make her office completely paperless. Now, some people are saying, okay, well, that's fine. We've heard that before. What good is it? Well, the obvious one is you get rid of the paper files. Okay, that's, I'll put it in blunt words, cute. What does that mean to the physician? It means they have space to make that a profit space. What I mean by that, they can make it a patient room. They can treat another patient. So they can have multiple patients being serviced where before square footage was being used to hold records. Second, and this one was a highlight of hers, she can provide better service to her patients. That was one of the driving factors to her. She wanted to be able to support her patients regardless of where she was at. She didn't want to have to be only in her office to be able to provide service. And she kindly gave me a story about being called away on a weekend while she was away at her mother's house. And a patient was panicking because they needed some care. And she was able to, in 10 minutes, contact the patient with her full medical history in hand and give a proper diagnosis for her. That power is there. It's not something magical you have to have or something very expensive. She used the internet. Actually, she used her laptop at her mother's house to get on the internet and access her records in her office, which leads to another point. A lot of people discuss about doctors or medical records and accessibility and security. Security is a major, major point to discuss. I know none of us here would want our medical records exposed to anybody else. And nobody wants medical records in a centralized location without really understanding what that location is all about and how secure that is. Yet today, our physicians have our medical records in their office, in files, in cabinets. So if we see 12 different doctors, 12 different doctors have our records. If we've gone to the hospital, guess what? They have our records. Our theory behind it is, the reason it's there and the reason it's accepted is because those doctors have taken oaths, the hospitals have code to live up to secure that information. Automate that. Give them the tools to automate it. Make it electronic, if you will. The goal, if you will, in technology or in the healthcare industry is to become more technology rich, better service the patient.